So, welcome in the discussion of the Quiz-2. So, for those who are attending my class for the first time, I just want to inform you that every day at 1 p.m., that is in the afternoon, from Monday to Friday, I give a quiz of around 7 questions on my Telegram group. The name is Dermatology by Dr. Cheshta. Now, I will be uploading the videos of the discussion of the questions on my YouTube channel, that is Dermatology Pearls by Dr. Cheshta, every day between 9 to 10. So, I would be requesting all the students to please subscribe this YouTube channel and also please join my channel on the Telegram, that is Dermatology by Dr. Cheshta, so that you can be updated with all the new questions, the expected questions, and which is absolutely free for you on both these platforms. Now, for those who don't know about me, I'm Dr. Cheshta Agarwal, the NEET PG educator. I have around 7 year experience of teaching the pre-PG aspirants of all the exams, whether it is INI, NEET PG, or FMG. I have myself scored all India rank in my NEET PG entrance examination, that is 261. I have more than 10 published articles on the international and the national journal, and I'm also co-author in one of the very renowned textbook of dermatology. The first question which you had received today was this. For those who have not attended the quiz, you can just try answering it. The question was, you have diagnosed a patient with vitiligo based on history, physical examination, and wood slamp examination. Which of the following test is also warranted? Full thyroid studies, HIV testing, HbA1c, or ANA? The correct answer of this question is option number 1. Please remember, vitiligo is an autoimmune condition. In this, you have autoimmune T lymphocyte destruction of the autoimmune T lymphocyte mediated destruction of the melanocyte. Now remember that it is a nature of an autoimmune disease to always present together in group. So when there is one autoimmune disease, you always need to look for the other autoimmune diseases like the thyroid diseases, the muscle involvement like myasthenia gravis, pernicious anemia, etc. The incidence of thyroid is maximum, and that is why in a patient of vitiligo, you will warrant a test, that is a full thyroid study. So the answer of this question was option number 1, full thyroid studies. The next question which was there today in your quiz was a patient with unilateral blue-brown speckled patch involving the malar phase. The biopsy showed increased number of elongated dendritic melanocytes which are scattered throughout the dermis. The normal collagen pattern was seen. What is your diagnosis? Please remember, all my students, the correct answer of this question was. Now, one thing which I want my students to note in this particular question is that the melanocytic proliferation, increased number of melanocytes were present in the dermis. There are 3 conditions where the melanocyte increases in the dermis. And what are these 3 conditions? These are nevus of Ito, nevus of Ota, and the third one is Mongolian spot. In all these 3, either there is increase in the melanocyte count or there is increase in the size in the melanocytes. The difference is the site. In nevus of Ito, it is mainly on the scapular region. In nevus of Ota, it is mainly on the face, that is unilaterally. And in Mongolian spot, it is present on the lumbosacral region. The question clearly mentions that the lesion was present on the malar face, that is on the trigeminal nerve distribution unilaterally. So this has to be a patient of nevus of Ota. Yeah. A very close differential diagnosis of nevus of Ota is a blue nevus, but please remember, in blue nevus, the collagen pattern is abnormal. Here, the collagen pattern is normal. So the correct answer becomes option number 1. The next question, which of the following are the epidermal melanin disease? So this was another question which was there in the today's quiz. As I told you that we have proliferation of melanin either in epidermis or dermis. The examples of proliferation in the dermis was nevus of Ota, Ito, and Mongolian spot. But what are the example of epidermal melanin diseases? These are 2 conditions. One is Baker's nevus and another is freckle. Baker's nevus is present unilaterally on the trunk in an adolescent individual. It has associated hypertrichosis. While freckle, it is mainly seen on the face and it occurs secondary to sun-induced increased production of pigment. How do you differentiate the epidermal melanin disease from dermal? Please remember, epidermal melanin disease, they are brown in color. While dermal melanin disease, as we have already seen this image, they are bluish, violet or greenish appearance. So that is how you can differentiate both these images. The correct answer of this question is option number 1, that is 2 and 3. The next question was this: a patient from Himachal Pradesh get a thorn prick and subsequently presents with a verrucous lesion. What can be the diagnosis? Anybody can tell me the diagnosis? Amazing. The verrucous lesion secondary to a thorn prick. The most probable diagnosis is chromoblastomycosis. Recently in INICT 2022 we got a question from the same topic, as well as in NEET PG 2022 also we got the question from the same topic. In chromoblastomycosis, you see a verrucous or a cauliflower growth on the trauma prone site. And when you do a histopathological examination, you will see a very characteristic body which is known as copper penny bodies, also known as medullary bodies, also known as sclerotic bodies, also known as sclerotic bodies. So please remember, the patient from Himachal Pradesh get a thorn prick and subsequently present with the verrucous lesion. The answer was question number 2. Another question was a disease caused by Staphylococcus R. The options were non-bullous impetigo, pemphigus neonatorum, erysipelas, and Retter's disease. The most common species causing non-bullous impetigo was Streptococcus, not Staphylococcus. Pemphigus neonatum is another name for bullous impetigo. And please remember, all my dear students, that bullous impetigo, it mainly occurs secondary to Staphylococcus. It mainly occurs secondary to Staphylococcus. What is erysipelas? Erysipelas is a streptococcal infection. And what is Retter's disease? It is nothing but staphylococcal scalded skin syndrome. Another name for staphylococcal scalded skin syndrome. So the correct answer is number B and D, that is option number 3. You can also follow this particular table that the most common cause of furuncle carbuncle folliculitis, bullous impetigo, toxic shock syndrome, and staphylococcal scalded skin syndrome, which is also known as Retter's disease. The cause is staphylococcus. While for scarlet fever, erysipelas, ecthyma, cellulitis, erythema marginatum, and erythema nodosum, streptococcus species is most frequent. One of the question is, a 60-year-old man presented to his family physician with concern about a spot on his ear. There is a dark lesion which is present on the left ear, and the patient says that he has always had a mole in this location. Which of the following is the characteristic feature reassuring this patient's condition? Now please remember, long-standing mole in an elderly patient. The long-standing mole in an elderly patient should raise a suspicion of malignant melanoma. The question is, which of the following four options will reassure the patient that this is not a case of malignant melanoma? So please remember, we have a criteria which is known as ABCDE criteria. If a mole shows sudden evolution in the terms of asymmetry, when the border becomes irregular, when the color becomes variegate, when the diameter increases to more than 6 mm, and all these three or four things occurs suddenly. So sudden evolution in either of these 4 points, this will give you an idea that we are dealing with a patient of malignant melanoma. Which of the following point is reassuring that the mole was single and uniform in color? When it is single uniform, it is unlikely to be a case of malignant melanoma. The correct answer becomes option number. I hope you have enjoyed these short series of quizzes on this YouTube channel. I would request all of you, if you want to attend this quiz live, you have to follow my Telegram group, that is Dermatology Pearls by Dr. Cheshta. Dermatology by Dr. Cheshta. You can also follow me on my Facebook page, Dermatology Pearls by Dr. Cheshta. You can follow me on my Instagram handle, Dr. Cheshta Agarwal. And you can also subscribe this YouTube channel, that is Dermatology Pearls by Dr. Cheshta Agarwal. I request all my dear students to please kindly follow me for more live sessions, mnemonic sessions, PYQs of dermatology. Thank you and all the best.